Good afternoon again and welcome to part 2. Weight shifting and repositioning while in the wheelchair is an important aspect of protecting our patient's skin. Often we remember to turn the patients in bed but neglect to reposition the patients who are sitting up in their wheelchairs or in a jerry chair, a bedside chair, or a shuttle chair. In the LTAC, patients who sit up in wheelchairs are provided with skin protection cushions. While they do protect the skin by redistributing the weight, they are not the only defense against pressure areas. Weight shifts and repositioning are vital. Shuttle chairs, jerry chairs, and bedside chairs offer very little skin protection, so repositioning and weight shifting is super important. Patients should be repositioned every 30 to 60 minutes ideally, but at the least, it should be incorporated into patient rounding and/or turn time. I'll give you a few ways that you can redistribute patients' weight while they're in the wheelchair. Go ahead and lean back. So if your patient is kind of semi-reclined in the wheelchair and you need to reposition them, you have two options at this point. You can recline them a little bit more, obviously giving them a nice little pillow to support their head. There we go. And if the patient has already been reclined, then you can bring them up a little bit. All of this redistributes the weight, allows blood flow into the previous pressure areas. I'm going to take that pillow off. You can also assist the patient with an anterior lean. Come back here at the scapula and the trunk. You bring the patient forward. At this point, you're allowing blood to flow to the sacrum and the coccyx, decreasing those pressure areas. If you can, keep them in this position for about 30 to 60 seconds, allowing that blood flow to return, and then you can bring them back. This is really helpful when you have a patient you need to do a weight shift with who is not in a reclining wheelchair. When you have a patient who's in a jerry chair, shuttle chair, or a bedside chair, you can change the angle of the recline just like you would in a reclining wheelchair. You can do an anterior shift if that works with that particular patient. You can also, in the shuttle chair, open up the angle a little bit more into a more supine position. And there's also a tilt function in the shuttle chairs where you can tilt the seat of the chair back, and that will also redistribute the pressure. Patients who are unable to move or don't have sensation need to be closely monitored and should not sit for more than 2 hours at a time. Patients with active breakdown should not sit without a skin protection cushion, and they still require weight shifts. Clearance through the physician for a sitting program is the best practice with these patients, and any change in skin condition should be reported to the nurse or the physician. We hope that you have enjoyed this short video and can use these tips to better serve our patients. See you at Skills Check!